We're living in a community that already has a lot of health issues, including HIV, heart disease, diabetes, and obesity. In fact, the diseases is higher in the Caribbean. Meeting these needs is a tall order for the healthcare system. Dr. Gloria Callwood is an expert in the field and tells us why.
Dr. Gloria Callwood, Director of the Caribbean Exploratory Research Center, talks about the territory's healthcare shortfalls and why climate change and health disparities could make it worse.
Health disparities are the differences in health outcomes between minority persons and whites in the United States. Health disparities in the Virgin Islands are those of heart disease, hypertension, to HIV/AIDS, obesity, cancer. All of these chronic conditions compromise the person's system. When we think about climate change and the impact of rising temperatures in the air and rising temperatures in the sea, more rain, we can understand how fish poisoning and dengue fever from mosquito bites, then we can understand how those persons whose physical conditions are already compromised will be further at risk. And so the climate change can have a major negative impact on persons who are suffering from health disparities in the Virgin Islands.
It has long been known that mosquitoes are the carriers of the dengue virus. With climate change, they're expected to grow faster and bite more because of the increased temperatures. Let's take a look at this clip.
First comes the rain, then the heat. Add enough breeding grounds, and you have lots of mosquitoes. If one of these mosquitoes has the dengue virus or bites someone with dengue and then bites you, a few days later you start to feel bad. Symptoms like fever, rashes, abdominal pain, and if you're already chronically ill, it might get worse. Check with your doctor.
We're fortunate to have with us in the studio Dr. Thelma Root Watson, who is the medical director of the Schneider Regional Medical Center. Dr. Watson, welcome. What are the signs and symptoms of dengue, and how is it treated?
The signs and symptoms of dengue include fever, which can last anywhere from 2 days to 7 days. That's associated with headaches, pain behind the eyes, muscle aches, rashes, and sometimes the patient is also very weak. Patients who progress can have bleeding because of the low platelet count. Dengue fever is treated symptomatically with rest, Tylenol for the fever and aches, no aspirin because we're afraid of patients having bleeding episodes because of the low platelet count. Patients are also encouraged to drink a lot of fluids because fluid hydration is a very important part of the treatment of this disease, whether we use intravenous fluids or the patient takes the fluids orally. In fact, if patients feel like they are having dengue fever, they should drink a lot of fluids.
Well, Dr. Watson, do you think you see your patients early enough in the process? When do you see Virgin Islanders who think they have dengue fever? When do physicians see them?
Patients do come to us pretty early because there's a lot of awareness of this disease. So we see them early. There are few who present late, and those are the ones who will have challenges in terms of going on to having the hemorrhagic form of dengue fever and the shock syndrome.
Are the physicians in the territory aware of the symptoms enough so that we wouldn't be in the category of countries that don't have physicians that know how to take care of this disease?
I believe our physicians are aware of the disease and the disease process. In fact, recently we had a seminar by the Centers of Disease, CDC, the Centers of Disease Control, who came to St. Thomas and did a very nice seminar for our physicians and our healthcare workers on dengue and the treatment of this disease.
Now, on the ciguatera side, what are the symptoms of ciguatera and how are the patients treated here in the territory?
Patients present with symptoms of ciguatera usually within 48 hours of ingesting the fish that's toxic. And the symptoms include nausea, vomiting, abdominal pain, itching. Sometimes they are very profoundly weak because of the nausea, vomiting, and diarrhea. Patients may also have a difference in sensation. They feel something cold and they experience it as being hot. The treatment of ciguatera includes medication for the nausea and vomiting, medication for the itching, which includes Benadryl and other prescription medications. Charcoal is also very good in the treatment of ciguatera. And patients also are treated with intravenous fluids. And sometimes we have to treat patients with medications that would increase their heart rate because the ciguatera toxin actually can slow the patient's pulse severely.
How long do these symptoms last?
It varies. The acute phase of the nausea, vomiting is pretty self-limiting, usually 24 to 48 hours. However, the neurologic symptoms can last longer, especially that temperature sensation that I spoke of earlier.
Well, thank you. I think those of us that have had fish poisoning with ciguatera are very aware of that. Thank you.
And thank you again, Dr. Watson.